How can we support occupational therapy students to develop their client and co-worker communication skills? Hi everyone, I'm Claire Batkind from Your OT Tutor. In this short little webinar, I'm going to give you a bit of a run through of some of the ways that you might be able to evaluate the communication skills of occupational therapy students during their clinical placements, in particular in an Australian context. And we'll also touch briefly on the SPEF-R2, which is the main evaluation tool that we're using here in Australia for evaluating, particularly the longer block placements for more senior students. So we'll dive right in and get started. In this session, you'll be able to hopefully identify some learning resources to help you understand the SPEF-R2 if that's new to you, be able to list some student behaviours and skills that are covered in the SPEF-R2 domains 3 and 4, which are the communication focused ones, and outline some examples that are relevant to different settings and caseload, so what that actually looks like, and describe strategies to implement if the student is having difficulty meeting the expectations in those communication domains. So a few SPEF-R2 tips. So just if you're new to the SPEF-R2, often when you first come across it, it's maybe a senior or somebody telling you this is how we fill it in, or you're kind of using the manual to feel your way through. But there are some things that could make it a little bit easier. So the first thing is that there is actually formal online training available for how to understand, interpret and fill in the SPEF-R2, which not everybody knows about, but it's developed by the University of Queensland, which is also the university that developed the tool itself. So you can jump onto their website. The link is up here at the top here. And you can see that it's just called SPEF-R2 training. Lots of different modules that will actually walk you through a whole lot of things. That website also has some video examples as well that might be helpful for you in terms of guiding your student during the clinical placement, and also then how you can assess their skills when it comes to doing their evaluation at the end. So that's one thing that could help. The second thing is that if you've ever looked at the SPEF-R2, they're quite, general examples and things and items that we're rating the students on, because it needs to be appropriate across any sort of clinical placement that OTs may find themselves in. But that can sometimes then make it harder when it comes to doing the evaluation, particularly if you also get the student to do their own self-evaluation, which is highly recommended. That you might be interpreting the item as meaning one thing, they might be interpreting it as meaning something else, and then the scores don't really align and you're kind of not really on the same page. So what you can actually do, and a lot of OTs in Australia have done this, is that you create your own customized version of the SPEF-R2 that's appropriate to your clinical setting or caseload, and you can give the students really practical examples of what each item on that SPEF might look like when it comes to the evaluation side of things. So we're going to go through some of my examples on the next slide about what those communication examples could look like if you're customizing the SPEF-R2 for those domains 3 and 4 for the topic for today. So I'll go through some specific examples there, but just as a little disclaimer, don't feel that, oh no, I don't have one of these, I need to rush out and create a full customized SPEF before my first student. I always like to think smarter, not harder. When you've actually got the students there on placement with you, use them to help you co-create that document, basically. How do the students interpret the different items? What sort of feedback are you giving to the students when they say, oh, I gave you a 3 on this item because, and then you might give them a specific example. Use those examples, cut and paste them straight into your own SPEF-R2. So then by the time you have your next lot of students, you've already got the bones of a customized SPEF example that you can use. And then you might just need to keep adding to it over time. If some students have some different examples that come up, that's obviously something you can add in. And then the plan would be that once you've got that, you can actually, when the next lot of students comes, you give that to them as part of their, preparation for supervision, so they can evaluate themselves against the same examples that you might be judging them against. For those that know, there is an online version of the SPEF-R2, and you can actually cut and paste your own customized examples straight into the online version. So that will actually be sort of printed out for the students as well, or kept in the one place. The only slightly annoying thing is that if you have students from different universities, you'll need to cut and paste in your examples for each university type login, because they have their own separate logins. But once you've got the bones there, it's a very easy cut and paste job that even an admin assistant would be able to help you out with. You could also ask, some of the universities may have had some little working projects or different workshops before where they've worked with OTs to develop their own customized examples. So if you work in a fairly standard sort of caseload, maybe like a hospital inpatient caseload or a general community outpatient caseload, there may be a university that's got some customized examples. So if you're having a student coming out on placement with you, you could always reach out to them and ask if they've got some examples that you might be able to use as a starting point. And obviously, if there's others, if that you've got your own ideas, feel free to drop some examples or some suggestions in the comments, or just reach out to those peers around you that you know have students, because they may have created something that they're very happy to share. Okay, let's jump into the communication domains. So what behaviours and skills should we actually be covering when we're looking at those domain communication domains? Basically, I'm just going to run through each item with a few examples. So it's not designed to be an exhaustive list, and the examples I give here may not really be things that come up in your caseload, but they're just as examples, hopefully, to give you a bit of inspiration for what you might be wanting to put in a customized spec, or what you might be wanting to evaluate the students on for these domains. So domain 3.1 is collaborates, cooperates, and negotiates with co-workers and student peers as appropriate to workplace. So it's using those communication skills to get along with people well, I suppose, is the main focus of this item, in particular with the peers that they're working with, or with their senior clinicians that they might be working with. So are they able to use and modify language appropriately when they're communicating with other staff members in both formal and informal settings? And in particular, can they modulate that so that it's appropriate for the setting, where they might be allowed to be more informal in the lunchroom, but need to be more formal when it comes to a case conference or family meeting? Are they able to utilise things like MS Teams or Zoom to confidently and competently complete one-on-one meetings or team interactions? And in terms of that negotiation part, are they able to negotiate task allocation fairly when working with another student on a placement? So it's quite common to have two students on placement together. Do they work well together to make sure that they both get a fair chance at equal opportunities at learning and having a go at things? Or if they're working on projects, are they divvying up the jobs fairly? That's 3.1. 3.2 is that they actively and effectively participate in workplace communications. So this could be that they're participating in team meetings and case conferences appropriately and with confidence. And the thing to keep in mind is that judging sort of against what would be a fair expectation for where they are in their university studies and where they are on their placement. So you wouldn't expect a second year student to be able to completely hand over what an OT one of the OT patients is doing in a hospital case conference on their first day, but maybe by the end of a fourth year placement, you'd have that expectation that they'd be able to basically speak up as an OT appropriately in those team meetings. Are they able to identify the best method for communicating with staff depending on the urgency of the matter? So is it via Teams or email or phone call, paging someone, face-to-face discussion? So that's looking at going back to that sort of actively and effectively part of their communication. So if there's something urgent that they really needed to call somebody about and hand that over, are they doing that, or are they kind of feeling not really confident, like, oh, I'll just send an email and hope that gets through in time? That's sort of the things that you could give as examples for feedback there. Do they prepare for one-on-one and team meetings to maximise their ability to participate in discussions? So, for example, if you say, okay, case conferences this afternoon, you'll be doing a bit of handover for Mrs. Brown, you'd expect that they're actually preparing for that. And when the time comes, they're not sort of saying, I don't know what to say. They've kind of had enough time to be able to plan and to speak with you to know what they're going to say in that meeting. And do they initiate formal discussions with co-workers and structure their clinical discussions in a way that provides clear clinical handover? So an example could be that they're using the ISBAR format in their clinical handovers, and your feedback can be whether they're doing that well or that they need to improve. 3.3 is whether they're effectively explaining information to others. So again, they could be providing succinct clinical handovers to other OTs or OT support staff. And you might see that I've covered clinical handover in this little item and in the previous one. So that's probably a good point to make, is that don't get too stressed out about which examples go under each item, because at times they can overlap a little bit, and different OTs or students will interpret where the best place to put it is, in different sections. So as long as yourself as a supervisor and the student are on the same page when it comes to the evaluation, don't stress too hard, as long as it makes sense. And you will see that some behaviours will come up even in different domains again. So might be in different items within the same domain, but also within different domains, the same sorts of skills. So another example is that they're able to articulate their clinical reasoning to other team members when required. So, for example, why a commonly used piece of AT is not suitable for a particular client. So in that customized example there, I gave a really specific, concrete example because, sometimes if you're saying to a student, oh, you're not really clear when you're explaining your clinical reasoning, they may actually have no idea what you're talking about or what they need to be able to do specifically to be demonstrating, that clearer clinical reasoning articulation. So giving an example, when you're explaining to somebody why that piece of AT wasn't suitable, that could have been clearer and you needed to explain all the things that you had considered. That sort of example can be really helpful. Are they able to choose when written, verbal, and or photographic information is required when explaining information to other staff members? So just remember, this domain here, domain 3, isn't talking about how they interact with clients at all or the client's family members. It's just co-workers. So it's okay if they're choosing some sort of medical jargon as long as the other profession would understand that, but maybe not so appropriate to be using OT terminology that nobody has any other idea what we're talking about. Are they knowing when what we're saying is not really clear, and maybe if we could show the physio a photo of the particular piece of AT that we've got in mind, it might help for some joint treatment planning. Are they able to provide presentations such as tutorial session, journal club to other staff members or students in a professional and confident manner? So for final year students, maybe the third or fourth years, a lot of universities will actually have a little task for the students to complete where they give some sort of mini presentation to other staff members. They might make that quite specific or quite general, or they may not be a requirement to do it at all. But I always like to throw it in there for fourth year students as a good way to give them an opportunity and for me to be able to evaluate them against this particular criteria as well. Obviously, if you're giving them a little task, it doesn't need to be huge and scary for them. It could just be a 10-15 minute presentation about a case study or a client they're working with, or a particular assessment tool that they're using, or a treatment strategy. Give them a bit of a scaffold for what you'd like to present if they don't have their own from university. Make sure you also give them time within your work hours for them to be working on this. It shouldn't be an extra activity that they have to do after hours for homework. Build in some time, but that sort of time when they're working on this is also a great opportunity for you to catch up with your own admin. So where they're still learning. So great opportunity to get lots of benefits out of fitting in that little mini case study. If you're doing a case study type presentation, it's also a good way for you to judge what their clinical reasoning is, which will help with evaluation for other parts of the SPEF-R2 domains, like their information gathering or their service provision domains. Okay, we're up to domain 4 now, which is communication skills. And this is the one more specific to clients or their families, caregivers, all their other stakeholders besides the people that the OT students are working with as colleagues. So 4.1 is that they develops, maintain and closes collaborative relationships appropriately with service users. So it could be things like they're gaining client and family consent for OT interactions, they're utilising appropriate strategies to build rapport with clients. And if they have a bit of a mixed caseload, you might actually give some feedback specifically about, doing really well with adults, but I can see it's a little bit more difficult trying to build that rapport with children. So giving really specific examples. Ensure that they're maintaining boundaries between personal and workplace interactions with clients. And obviously, this is going to be a little bit more challenging, maybe if they're working with clients that are a similar age to them, or if they've had other things going in their life where they've come across people with the same diagnosis, which might trigger some things for them, or maybe in a small country town where everybody knows everybody. It's going to be a bit harder for to make sure that they're maintaining those boundaries. They could also be advising the client or families when ongoing care will be provided by a different OT student prior to completion of placement. So that goes into that closes the collaborative relationship. Does it, at the end of their placement, they just be like, don't say anything to the clients, or do they actually give that feedback that, okay, this is my second last day, I probably won't see you again, the next OT to see you will be this person. 4.2 is that they communicate effectively with significant others as appropriate. So it could be they're correctly identifying when a significant other should be involved in OT sessions, and they're seeking permission from the client appropriately before they just go out and call everybody's contact number that they've got. That they're demonstrating respectful listening and questioning, demonstrating appropriate verbal communication skills. So this is where that use of jargon really does become important, or any sort of slang that maybe people of different cultural backgrounds won't understand our Australian slang. those sorts of things we want to really give feedback about. Do they demonstrate appropriate non-verbal communication skills, such as body language, eye contact, seeking permission before they do physical contact? And obviously that's going to be different depending on the type of population that you're working with. Sometimes eye contact is really important, other times it's not appropriate. It can actually sort of have the opposite effect that we want in terms of rapport building with clients. So giving really specific feedback about what they're doing well, maybe why they might need to do things differently with different clients. And do they provide prompt updates to clients or family members when progress is made with OT interventions, such as updates regarding sourcing of equipment? So again, a very specific, concrete example. If you're giving those to students verbally during your evaluation sessions, make a note of some of them and add it to your SPEF-R2, because that, again, those concrete examples can really help some students understand what they're being evaluated against in terms of those criteria. So next one is 4.3. So demonstrates responsiveness to service user or significant others. So this could be things like demonstrating empathy appropriately and acknowledging the impact of disability illness while being mindful of their language choice. So this is sometimes a bit of a fine line between demonstrating appropriate empathy without being overly sympathetic, or sort of making the client feel like you're treating like, oh, poor you, let me fix you sort of thing. We don't want that sort of approach to be coming across, but it can be hard for students to understand or to get that balance. So we can give really specific feedback and examples section on that. Are they able to modify planned assessments or interventions when required? So if the client's becoming upset or unable to maintain concentration, or they're looking obviously like they're in pain, is the student picking up on those sorts of signals and then making a change to their plan, or are they kind of like plowing through with whatever plan they had in mind, even if the client appears to you to be struggling? And do they acknowledge and respond to concerns raised by the client or significant others, including seeking assistance from the supervisor when they don't know the answer? So this is, again, if a family member asks them a tricky question, are they kind of trying to fluff their way through and just giving them anything so it looks like they don't sort of lose face in front of the family, or are they able to appropriately identify, that's actually a bit of a question I'm not sure of, let me talk to my supervisor and get back to you? Are they able to make that decision confidently and give an appropriate response? As well as just, if somebody does raise something during initial assessment or something like that, that they're not ignoring it because they think, oh, too hard, I don't know, I'm just going to pretend I didn't hear that and keep talking. Are they actually acknowledging that, oh yes, I can understand that's really tricky that the doctor hasn't come and spoken to you today. I can try and find out for you what the plan is. Those sorts of things. 4.4 is that they express their clinical and professional reasoning and recommendations clearly, ascertain service users' understanding. So again, this is more towards that. Are they speaking in a way that the client can understand? So are they utilising a range of techniques to explain information to patients, such as demonstration or videos or handouts? And this sort of also comes into mind, are they even questioning, that a paper handout may not be the best way to explain information to every client? So are they thinking about what's going to be the best option for each individual client? They seek clarification from the client if they decline the OT recommendations to ensure that the client can make an informed decision, and are they negotiating alternative options appropriately? So if they say, look, I really think you need a shower chair, the client says, no, don't want it. Okay. Do they just leave it at that, or do they do a little bit more digging just to make sure that the client's fully aware of any risks that they're taking on? Do they have appropriate use of interpreters when they're required to ensure the client understanding, particularly for things like maybe doing a standardized type assessment? Do they ask clients to demonstrate their understanding of the information provided in a respectful manner, rather than just sort of telling the patient information and assuming that they understand? What are they doing to actually check that that understanding is there? Are they able to explain when a task requested by a client or member of the support team is outside of the OT scope or not likely to be funded by the NDIS, and discusses appropriate alternatives? So that's a very specific example for those maybe working in the private sector in Australia with an NDIS caseload. So again, just think you can be as specific as you want to be to make it really clear to the students when you're doing your evaluation. And the last one is 4.5, shows an awareness of and manages group dynamics. So for some cases, you might see groups as just purely client sort of therapy groups, that they're working on different activities together. In some caseloads, OTs might class group dynamics as maybe going to a family meeting with colleagues, but also the client and their significant others or families there, and they judge that as a bit of a group setting. Not really a huge right or wrong answer, but as long as everyone's on the same page. And in this one, it could be that it's just not applicable. Like there's no groups that they're really going to come across. That's fine. Or it might be that maybe there's just one group in their entire 8-week placement. You might rate that as an insufficient observation. Like you just haven't had enough opportunity to assess what their skills truly are in that group setting. And they're completely fine. They still count as basically a pass. The student's not going to fail if they get an NA or an insufficient observation. So what are some examples? So it could be that they're able to interact appropriately in large stakeholder meetings with clients, including providing recommendations within the OT scope of practice. Could be that they're identifying a client's need for one-to-one assistance during a group session and delegates responsibility to the OT assistant appropriately. So if they're not the only one running the group, are they able to make that call in terms of, well, this person definitely needs me, I need to be the one doing that, versus doesn't need to be me, it's more important that I'm running this session, I'll get an OT assistant or somebody else to help this person one-on-one. And are they able to do that one-on-one support themselves if needed? So able to redirect clients who are becoming disruptive maybe during group sessions. But hopefully that's given you a lot of really practical examples of what some of those communication skills might look like when we're coming to do this evaluation. We'll keep going to the next section, which is, but what if the student is actually struggling? So we're going to talk about some strategies to assist students who might be having difficulties with their communication skills. But first, what might it look like if a student is struggling with communication skills? Now, I always find when I'm at a sort of webinar lecture, it's easier for your learning. You'll probably sink in more if you actually have a go at answering these things yourself. So test yourself and then check some answers rather than me just going blah and telling you what I think. So if you are watching the recording, feel free to pause, write down a few notes about what are the things that you think you're seeing if a student is struggling with communication, and then unpause and I'll give you the answers. I know lots of you probably didn't press pause, but we're going to give you the answers anyway. So it could be that they're remaining too casual when they're participating in workplace discussions with colleagues. And that's, keep in mind, is it despite feedback that you've given and role modelling. So if everyone in the workplace is insanely casual, more so than maybe what you'd expect in other workplace settings, it's really harsh to judge the student in terms of saying, oh, you're a bit too informal, when that's not being role modelled. So just being fair in terms of what sort of feedback you've given, role modelling they've seen, and judging them against those criteria. Significant grammar or word choice errors in their documentation could impact clarity. So another domain of the SPEF is actually focused on documentation. So sometimes all that written communication will go just in that domain, and that's fine. But some OTs will cover things like email communication in these communication sections. So that's fine to include as well. It could be that they're not contributing to team discussions. And again, despite you helping them practice, giving them scaffolding, like not expecting them to speak up in a big case conference full of consultant doctors, maybe you've given them the way to introduce the topic that you'd like them to cover in that case conference, and they're still just not speaking up as you would expect them to for their year level or their part of where they are up to in their placement. Maybe they're not demonstrating empathy or acknowledging those client concerns. Sometimes it's just they don't know what to do, so they're kind of just ploughing through, or it's just that they're not actually picking up on some of those subtle signals that the client is struggling in some way. Is there significant misunderstanding of the information provided by the client? So this could be an example if English is their second language, and they're just missing some of the words that the clients are using that are really important pieces of information, and they're missing that, and that's impacting their information gathering, and that's impacting their ability then to set appropriate therapy type plan or discharge plan. Or can they not articulate their clinical reasoning to their supervisor or client? And there's lots of different ways that you can try and allow them to do that, which we'll talk about soon. Another little stop think section that again, you can pause and have a think of what you think the answer could be. So what if English is the student's second language? Does this alter the standard you expect to pass the student? So have a little think. Would you lower your standards if you know English is the second language and it's going to be a bit more difficult, or do you think you still need to judge them against the same criteria? Okay, so I'll let you know what my suggestion would be. At the end of the day, when we're doing the SPEF and we're actually evaluating students on their placements, by the time they get to their 4th year placement, we're signing them up that they've passed. We're saying that they're ready to be new graduate OTs, and in this case in Australia, new graduate OTs ready to work in Australia, which is a primarily English-speaking country. So really we need to be judging them in terms of the competency standard that we would expect for an English-speaking OT. It's an Australian degree that they're getting. So it might be that the strategies that we use to help support their skill development are going to be very different if English is a second language, or the difficulties that they have will be different. But at the end of the day, the standard that they need to reach should be the same. Still need, obviously, if English is a second language, it might be a lot easier for them to exceed the standard that you want them to be able to achieve for you to pass them on their placement. But that bare minimum passing standard is what everybody needs to meet. Okay, we'll talk about why might a student struggle with their communication skills. So again, you can test yourself, have a little think, why do you think it is that students are having trouble when it comes to doing communication? And again, the language skills might be one, but I'll give you some more answers. So it could be, like I say, language skills. English is a second language, so the words themselves are tricky for them to find. So it's hard to maintain a conversation. Or it could also even be just different understanding of the cultural expectations and what that looks like in different social interactions and what's appropriate when it comes to communicating with clients. It could actually be their clinical reasoning. So what might come across as they're just not communicating, they're not speaking up in case conference, it's a communication difficulty. It's actually maybe a gap in their clinical reasoning. They just actually don't know what they should be saying, or they have no confidence that they will say the right thing. They're terrified they'll say the wrong thing. So they don't say anything. So just keep in mind that sometimes that what looks like a communication barrier can also be more of a clinical reasoning, or just not understanding the content of what they need to be talking about. And we'll talk about some strategies for that next. And finally, anxiety. So particularly in Australia, there's lots more universities make it really lots of adaptations to allow students that have maybe anxiety type diagnoses to do an OT degree, but when it comes to their placements, it's not a requirement that they actually disclose that to their supervisor. So obviously, if the student is confident enough to tell the supervisor that they have different sort of anxiety diagnoses, and they might need some accommodations or just some things structured a little bit differently to make it easier for them, then most OT supervisors are very accommodating in nature of OT. We can adapt, we can make things easier. But if they don't want to disclose that, then it might just come across as we're thinking they're just not communicating. It's a communication deficit. So we'll talk about maybe what we might be able to do to support students with all of these different potential barriers. So it could be the strategies to assist. So what could be the strategies to assist students having difficulty with communication? So number one is to ask the student. So there's a great scoping review written by Wendy Milgate from ACU as one of her PhD articles. She's exploring the topic of students who fail their placement, but in particular the student perspective. So this scoping review was called Failing Professional Practice Placements in Allied Health. What do we understand about the student experience? A scoping review. And at the end of the slides, there's a reference for that. Open access, so I'd really highly suggest you go and have a look if you work with students, to give you some ideas for how to address any students that might be struggling on placement in general. But one of the take-home messages from that is that often when it comes to supporting students, we're not really taking a student-led or student-informed approach. We're kind of thinking, oh, I think this is the issue, let's have a go at this strategy, that could work, without actually asking the student their opinion about what do you think the issue is, what do you think might actually help to address this. So that's number one. For no matter what's contributing to the difficulty with their communication skills, always try and give the student the opportunity to reflect on what they think it is and what they would like to try. Also reflect on your own expectations. So remember, we're not trying to evaluate a student's ability to be our mini-me and communicate exactly how we would communicate with clients or patients. We're trying to evaluate their ability to do a competent job of communicating with clients. So just take a step back and think about, am I judging them a little bit too harshly because they have a different approach, a different communication style to what I would when it comes to speaking with clients? But is what they're doing still appropriate? And some ways to sort of judge that could be that you could be setting really concrete objective goals and expectations about what is the appropriate standard, or you could also get them to spend some time with another supervisor. So again, removing that idea of, maybe it's different personalities, different communication approaches that's clouding my judgment. Let them spend time with another supervisor and get that supervisor's opinion about whether what they're doing is actually a competent standard. It could also be allowing them to access language tools where possible. So for all those English second language students, maybe at university when they're preparing for oral talks or things like that, they use lots of their like translation apps or grammar apps and things to really make sure that that side of things is easier. So if it's appropriate in your workplace for them to have access to some of those apps or tools, then we should be trying to facilitate that. So, let's make things as easy for them as possible to be able to perform at the standard that we're expecting. And then practice. So practice can look many different things. It could be role playing with other students. It could be recording themselves and then watching that back and critiquing. Or it could be that, like, for those students that just get overwhelmed by trying to remember too much that they need to cover, that they have little prompt cards that they can just glance down at to keep them on track. Or the first time starting a big initial interview in a hospital, maybe just let them go in with the initial interview form to help sort of guide their process through that. On the next slide, I just want to talk a little bit more about if it's a particular type of maybe reason why they're struggling and how the approach that we do to support them might be slightly different. So whether it's language, clinical reasoning, or anxiety. So again, ask the student, don't try and guess, I think it's a language issue or I think it's an anxiety issue. Always give them the chance to try and let you know what they think the difficulty might be. If it's a clinical reasoning issue, so they're just really not confident in the content of what they're delivering and it's coming across as them not speaking up or being really, lacking confidence, then it could be that you work through some written case studies to really help build that confidence in the clinical reasoning. So they're confident that they know what they're going to present in that case conference. It might be that you give them the opportunity to confirm the content with you first. So before you send them to go have a one-on-one chat with the physio, do a little, run through with me. What are you going to tell the physio so that you can give them that validation that 100% that is exactly what I would say, go for it. And that just might make that communication a bit easier. Or it could be if there's content overload, too many things for them to try and keep in their brain and then focus on doing a good job just speaking normally as a person, then you might just give them a small section to focus on at a time and obviously grade that up so that they're doing the standard that we would expect them to do based on their placement level by the time they finish their placement. Communication or that language is the actual issues. It could be that they're not really confident in the delivery. So they actually know the clinical reasoning really well. They can give you a beautiful written case study that explains exactly what they're doing, why they're doing it. But when it comes to explaining that to somebody, the patient or another health professional, it's just not coming out. And that can be sort of to do with the language barriers or other sorts of things like that. So giving them opportunities to observe you doing those things, reflecting on how you're communicating with others, opportunity to practice in a safe space. So it could be with students or a bit of a role play with yourself or in front of a mirror with a video, and giving them opportunities to then practice again in that sort of safe space, choosing the easiest scenarios to start with to really build their confidence. It could be that they actually want to write scripts to confirm their grammar and word choice. And once they're confident that they've got the right words and not going to say something inappropriate, it makes it easier for them to do that practice. Or it could be having them do some non-clinical communication type practice. So again, you just want them to have opportunities to do a little small talk, building conversations with clients and feeling confident in that sort of chit chat. It could be that you send them to the admin desk of the outpatient section of your OT department and they help guide people to the waiting area or what forms they need to fill in as they're coming in for their appointments. Or just chatting with clients. So could be that you've got either a client either in a community or maybe hospital setting that's just very open to having a chat. Don't mind if you do repeat that initial assessment again to assist the students learning. Obviously, just make sure you're strategic about the type of clients that you're choosing, make sure they're fully informed about how it's working and it's a bit of a practice session and are they happy to do that. And often for those that are bored in hospital just wanting to go home, they're very happy to have somebody come and chat with them. And then again, it's just opportunities for the student just to speak with the client. Could be tell me about your life story or tell me about something else, without them having to feel that they're going to miss important information, that they've been given this really big clinical responsibility. And then finally, if anxiety is the reason, so again, thinking back to what strategies are they actually using at home or at uni, and are they appropriate for them to use in the workplace during their placement? So if their strategy is that they just go to the beach when they're feeling overwhelmed and have a big sit down and wait and calm themselves down, then obviously it's not something they can do on their clinical placement, but thinking about what are some other things that might be able to fit in, whether it's a bit of a 5 minutes of deep breathing or they can go and listen to a mindfulness app somewhere. all those sorts of things. Also thinking about doing step-by-step learning. So not just giving them a whole chunk of, by the end, I want you to do this initial assessment, actually breaking that down, grading it for them. Which is the next point, they're gradually grading those task demands. Predictability in their schedule can also be really important. So don't go up to the ward in a hospital and say, okay, so today you're going to go do that initial assessment with Mrs. Brown. And they've never heard of Mrs. Brown. They didn't realize you're going to throw them into that situation straight away. Give them lots of predictability and warning so that they've got time to prepare and plan for those things that they might find anxiety provoking. Build in some time for relaxation strategy before session. So if it's something that's going to be big, they think they'll get a bit worried or anxious about, can you give them 5 minutes beforehand for them to just have 5 minutes by themselves to do whatever it is they need to do to help calm. And again, making sure they're engaging with their normal supports as much as they actually can to use those strategies that they know are working for them normally. And the summary is, so customize your SPEF-R2 examples if you can, but use the students to help you do that. Make sure you provide opportunities for them to demonstrate their skills in a range of different scenarios and settings, and maybe for different supervisor as well for another opinion. If the student is struggling, involve them when you're actually planning what strategies you might want to try, and really make them an active part of that process. And part of that should be really providing objective goals to work towards and role model that expected standard. Hopefully those tips will be helpful for you. Before you finish, this is hopefully a bit of a CPD learning opportunity for you. So it's always great to think about what's one thing that maybe I might stop doing, start doing, or keep doing as a result of watching this. Hopefully there was something that was like a little aha moment for you. Write that down and make a plan for how you can actually start doing that. And if you're an OT in Australia, you can count this as some of your CPD hours if it's related to your CPD goals. So make sure you actually write down a bit of a written reflection on how you're going to do these things for that AHPRA evidence. If you do have any questions, very happy for people to contact me via my website or send me an email or via the inquiry form. Lots of different ways you can find me. You can also find me on LinkedIn, have lots of content on LinkedIn, and we'll check my messages daily there if that's where you live. Happy for you to send me questions. That's the reference for the article by Wendy Milgate about students that were failing their placement, if you'd like to check that out. And there are just my contact details again for you. Hopefully that will be helpful for you. And if you do have any questions or suggestions for some other topics you might like me to cover in the future, very happy for you to send them through. Thanks for watching.